The purpose of this video article is to demonstrate that the step W classification for submucosal fibroids can be included in the transvaginal ultrasound examination. Uterine fibroids are the tumors most commonly found in the female genital tract, and submucosal fibroids are the ones that most often cause menorrhagia and infertility. In these cases, hysteroscopic myomectomy is a therapeutic option for patients with abnormal uterine bleeding and/or infertility, even where there is a need to cause the least possible myometrial damage. In 2005, Lasmar and collaborators published an article proposing a new classification for the description of submucosal fibroids in hysteroscopy. The step W classification was based on the parameters that hinder hysteroscopic myomectomy, and four criteria were considered: the size of the nodule, the topography of the nodule, the extension of the base of the nodule in relation to the wall of the uterus, and the penetration of the nodule into the myometrium. When the fibroid is located on the lateral wall, an extra point is added regardless of the affected third. Transvaginal ultrasound is the first-line diagnostic method for the diagnosis of fibroids and is mandatory before any type of intervention. Submucosal fibroids are very well evaluated on ultrasound, as shown in this video. Therefore, a step W classification for submucosal fibroids can be applied at the time of ultrasound diagnosis. As for the size of the fibroid, the largest diameters found on any axis are considered. When the nodule measures up to 2 centimeters, it receives a score of 0 points. If it is between 2 and 5 centimeters, a score of 1 point, and if it measures more than 5 centimeters, a score of 2 points. In the following exam, a submucosal fibroid with its largest diameters being smaller than 2 centimeters is observed. In this case, it receives a score of 0 points. Topography is defined by the third of the uterine cavity where the fibroid is located. If it is in the lower third, it receives a score of 0 points. In the middle third, a score of 1 point, and in the upper third, a score of 2 points. In the case presented, the fibroid is in the middle third, so a score of 1 point is attributed. Regarding the assessment of the extension of the nodule base in relation to the wall of the uterus, we must consider the wall in which the fibroid is located. When the fibroid covers a third or less of the wall, it receives a score of 0 points. When the base of the nodule occupies between 1 and 2/3 of the wall, a score of 1 point, and when it affects more than 2/3 of the wall, a score of 2 points. In this case, the fibroid covers 1/3 of the anterior wall and thus receives a score of 0 points. Penetration of the nodule into the myometrium assesses whether the fibroid is completely inside the uterine cavity, and in this situation, it receives a score of 0 points. If the fibroid has its larger part inside the uterine cavity and its smaller part in the myometrium, it receives a score of 1 point. And if the fibroid has its largest part in the myometrium, it receives a score of 2 points. In this patient, the intramural component of the fibroid is greater than 50%, so a score of 2 points was considered. When the fibroid is located on the lateral wall, an extra point is added, regardless of the affected third. In this transvaginal ultrasound examination, the fibroid is seen in the anterior wall without involvement of the lateral walls, so no extra point was added. After applying all the step W scoring system criteria for submucosal fibroids in this patient, the final score is 1 point. With a score of 1 point, this fibroid is classified as group 1. Therefore, for the treatment of this submucosal fibroid, based on the step W classification, a low complexity hysteroscopic myomectomy is recommended. In this other case, applying the step W classification system, the largest diameters are between 2 and 5 centimeters, and a score of 1 point is given. In this same case presented, the fibroid is in the upper third, so it receives 2 points. Also in this case, it is seen that the fibroid occupies 1/3 of the anterior wall, so no points are given for this criterion. The assessed fibroid presented has an intramural portion greater than 50%. Thus, a score of 2 points is given. The fibroid is seen on the anterior wall, with the lateral walls free, so no extra point was given for this criterion. With all the criteria of the Step W scoring system analyzed, this patient received a total score of 5 points. With a score of 5 points, this fibroid is classified as Group 2. Thus, for treatment based on the Step W classification, a complex hysteroscopic myomectomy is recommended, with consideration on the use of a GnRH analog and/or two-stage surgery. In this third case, a large submucosal fibroid is seen, and its longest axis is greater than 5 centimeters. Thus, a score of 2 points is given. Here, the fibroid occupies predominantly the upper third, scoring 2 points. Also, in this case, the fibroid occupies more than 2/3 of the affected wall, receiving another 2 points. The fibroid analyzed clearly presents an intramural portion greater than 50%, thus 2 more points. When a side scan was conducted, it was noted that the fibroid occupied the lateral walls, and a score of 2 points was given. Finally, with the application of the Step W classification, this patient scored 9 points. With a score of 9 points, this fibroid is classified as Group 3, and recommendation for treatment is a myomectomy by an alternative non-hysteroscopic technique. The conclusion of this video article is that the Step W classification may also be applied at the time of ultrasound diagnosis, and the transvaginal ultrasound report may include the classification of submucosal fibroids and possibilities for hysteroscopic myomectomy.